Well, the doctor is in, and it's geriatrician Dr. Chandini Sharma. And today we're talking about memory loss and aging. Dr. Sharma, so glad you could join us as always.
Thank you.
Yes, so when it comes to memory loss and dementia, what are some of the differences that people at home may want to know?
First off, let's use a myth buster right here. Is all memory loss normal with aging? No. No, 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 no. There is a certain amount of memory loss that happens with aging. And so people can still function with that memory loss. Seniors of any age, even 100, they can function with a little bit of memory loss. Sometimes they say, just like, what's your name? What's your name? Ah, Autumn, right?
So how do you know, like, maybe what's normal and what's
Right.
not?
So then, if there is more memory loss than expected for that age group, which is then affecting their function, like when they know that they were going to meet Autumn, but they forgot all about meeting Autumn. So when does that get to be a problem? When it starts affecting your day-to-day function. So the memory loss is, there is a certain amount of memory loss with aging that's normal. But here I'm going to clarify that all memory loss with aging is also not normal. Because when it gets into that affecting the function, when memory loss is affecting function, then that's called dementia.
And so when we talk about that, what are some screenings that people can do for dementia?
I can teach you all day long. Just go take the person to the doctor, because there are specific and very simple, clear ways of figuring out when you have abnormal memory loss, which is dementia, which is affecting your function, and whether medications can help or not. But here I would also like to point out something, that, for example, when somebody has a pain or has a fracture in their foot, I'm just giving an example, and is younger, but they want to get up and they're hurting, so anybody grabs them by the arm and says, let me help you. And the person accepts the help. But somehow, when it comes to memory loss, caregiving, gentle, respectful caregiving by a family member or a friend is somehow not accepted as easily by a senior, because they're like, I'm not forgetting, I'm not going to accept that help. So accepting the caregiving and respectful caregiving is so important with dementia.
And quick question for you, what are some ways that people could keep their brain fresh when it comes to dementia?
You know, as we heard a little while ago on that Medical Minute exercise, the best way to keep your brain healthy is to also do some form of exercise, maybe just walking.
Perfect, perfect. Thank you, Dr. Sharma, as always, for joining us.